So with a quick show of hands, how many people have interacted with their health care in the last year? Gone to see a doctor, or arranged care?
Okay, keep your hands up if that experience was absolutely delightful. You evaluated your options, there were no surprises with your medical bills. Yeah. Okay, so is there an experience worth in healthcare? And
How about taxes? I mean, taxes are pretty bad, but they were worse. Back in the dark ages, you showed up, you didn't know why you were paying what you're paying, you just knew you had to pay it, and you didn't really have a lot of choice or a lot of options. It has actually gotten a lot better. In the modern era, at least you have standardized tax forms, you know why you're paying it, you can hire somebody to help you with it, and you can even just snap a photo of your form and go ahead and file that right from your phone. So it has gotten better, it's a transformative experience there.
so when I started in the healthcare transparency space a decade ago, we were definitely in the dark ages. Doctor finders, cost estimators, they were all separate tools, and honestly, they were next to useless. Know before you go, forget about it. So we built an integrated solution that brought patient reviews, quality, and cost all into one place. We showed you your options. We helped you understand what to expect when in both dollars and time. And we hooked it up to your benefits so you could get real-time out-of-pocket costs. And it actually started to work. We got positive results. 30% of our users told us that they were making smarter healthcare choices with their doctors. More importantly, people were saving real money, both our patients and our customers. But there was a gotcha. We solved the part of the problem for those savvy users that were intelligent enough to use our tools, but we also exposed healthcare's complexities. We showed you a lot of, there's a lot more things to think about. We found that most people can't or don't want to become healthcare experts.
And a lot of the questions people have are actually personal. You're not looking for what's my benefit structure or what's a tiered network. You're looking for what should I do about my back pain, or why are that kid's inhalers so expensive? We also found another problem where people are having a hard time engaging. A lot of time it's a matter of not knowing what tools you have available to you. But even when we find that people are looking for the tools and they say that they would use them if they had them, they're having a hard time even getting signed up or getting registered.
So we realized we needed to take the next step. We needed to intelligently meet users on their terms, sparking questions, and then serving the right amount of guidance at the right time so that user could get the right job done.
And we asked people, what are you looking for? And we found that they were really looking for an expert that they could count on. And so we created one. We've got the healthcare advisors, and it's somebody that you can call or you can chat with, and they understand your benefits, and they also understand how healthcare works. So when you go and you ask them a question about, what should I do about this, they have a way to connect you to the right thing. And it's great to have a person that you can ask that, but there are some weaknesses. They're not always available. If you wake up in the middle of the night and your kid has croup and you're wondering, should you go to the ER or urgent care, they're not ready to answer that question for you right then. And the other thing that happens is that you don't stay in the same place. So what the healthcare advisor understands about you can change. Once I was on the Golden Gate Bridge trying to find a doctor, and because my son had just said, I think I have swallowed a nickel. And I didn't know the zip code.
So how do we take the next step? What if we look to the latest developments in healthcare? I mean, we keep hearing, and we've got all these great developments in big data, analytics, artificial intelligence, machine learning. I mean, really, aren't we ready for the next transformation in healthcare experience?
All right, imagine you have that kind of a trusted expert, someone that's intelligent and knows your context, knows who you are, and knows how all the things fit together. And then also imagine that that's an expert that you can ask specific questions. Say what's my HSA balance?
Is this service covered?
Or how long till I reach my deductible?
Or are my labs ready yet?
And now imagine that all of those things that you deal with in your healthcare, that they're all connected to the same thing. So instead of trying to figure out, how do I log into this system to figure out when my doctor's available, and how do I log into this one to see if they're covered by my plan, and then where do I actually get the appointment? You have all of that in one place, and in one conversation, you actually get that job done. And then finally, imagine if all of that is mobile, so it goes with you where you go. So rather than trying to say, I should figure out what doctor I go to when I get to a computer, you actually can do it when you're thinking about it, and you can get that appointment scheduled away. You might even be able to see the doctor online without even leaving your house. Doing those kinds of things, we can actually help people make smarter healthcare choices.
So our ask of you, come talk to us. We're actually piloting with folks, and if you're in healthcare or an employer looking to make changes, we'd love to hear from you. Thank you.
Thanks.